Hello, everybody. We are data Pharming, and we're going to provide the right people for the clinical trials. Now, getting a new drug on the market is a fairly complicated process. Overall, it takes an average 13 years from actually discovering the new molecule to getting it out on the market. As you can imagine, the clinical trials are mostly spent through that process, and it takes an average 5 years to test everything on the patients. Now, what you might not know is the price of those tests are actually very costly. In 2014, Novartis spent over 6.6 billion on those trials, in a range in between 40 to 60 products in the Scandinavian area only. Testing a single drug in Sweden only would cost around 15 million euros, not mentioning the time spent by doctors and the time lost by the company, which, as we all know, is a very valuable resource. Now, where do we go from here? Our solution is fairly simple. We provide a service to pharmaceutical companies to help them filter their patients on those screening trials better, up to 20% savings, which in this estimation would save them around 3 million euros. Now, how do we get the data?
So, how do we provide this solution? So there is a lot of resources available which we can put to our use. One is the insurance companies, not in the Scandinavian area but outside it. The insurance companies are really enthusiastic about this because it can save them a lot of money in the future. But for the Scandinavian region, especially Sweden, the National Inpatient Register is the one of the best sources which we can get. Now, what is a National Inpatient Register? Sweden is a country which plans to DNA sequence each and every of its citizens by 2020. Now, that's a huge source. Apart from that, the National Inpatient Register also has the data regarding the admissions, the operations performed on the person, the doctors involved, everything. And that can be used as a great resource, and it is available for research purposes. The other resources, there are many other sources from where we can get the data. It can be, there are many forums where where the patients talk to each other, to talk to doctors about their problem, and that can be a data which can be used. Apart from that, there are sources, even Novartis and many other pharma companies publicly specify their data. They publish their previous clinical trials in the online resources, even MIT. And finally, the pharma companies. Now, the pharma companies will be basically our clients, and that's why we need to keep their data secure. Their data should be used only by them. And with their data, with combining all of his data, we have a list of patients, either given by our pharmaceutical companies, or we can find them by our own using the National Inpatient Register. And we can filter out the people who are not required. Maybe they are 100% sure that they would not pass the previous clinical test. And that not only saves us the amount of money spent on them, the amount of money spent while testing them, but also the time of the doctors, the other resources involved, the company resources involved as well. So, what is our business revenue? We want to keep it simple. Our business revenue is simple. We are saving them at least around 3 million euros per test. And that's why we would like to charge between 10 to 30% depending on how much we save, depending on our discussions for our revenues per drug trial. So, how do we go forward with this? Initially, we need an investment of 100,000 euros, and Novartis here has promised to help us with that, and we are really enthusiastic for the first 6 months, with half of it actually, for the first 6 months to work with Novartis on our initial product development, and then we first launch our first drug trial. Finally, we go for the growth and improvements, and we modify our algorithm, we improvise on it. We even get to tap other markets like maybe the cosmetic industry. And after that, we can even, in future, we can even partner with other resources like Apple, like the applications that monitor health on Apple Watch or Fitbits. And even that data can provide more value to our customers. So, this is our team. It's Louis, and he has a really nice smile, and that's why we would keep him for sales and partnership. It's Vlad, and he's really glad to work on the cloud. It's Clement. He's French, so he's really good at bureaucracy, and that's why we decided to keep him in the business analysis. And finally, it's me, and I have an past experience of managing a team, and that's why I would go for the product development and big data. So how do we do it? A better world. We first use the data, enhance it, and finally create it. We create using Microsoft Fitbits and the devices. We use it, and it can even help us enhancing the product. This is towards a better world. Invest in us, not just because you think that this is a good business plan, a good model, but invest in us to save lives. Thank you.
Fantastic presentation. And so we have some skills in smiling and some skills in bureaucracy. Not at all. These are very, very much more sophisticated people. We have some questions.
Yes. Do you expect any problems or no problems with the actual data capturing and getting data out of these registers, stuff like that?
With the National Inpatient Register, I went through their documentation. It's a 3-week process to get a sample of the data which we can use in the beginning. But they do provide data for research purposes, which can be used. And maybe in future we can, because since the government, the Swedish government, or even the Scandinavian area, has a huge importance for it, because it can save them in future the expenses and the health. Plus another better thing is that by saving this amount of money, we can maybe reduce the cost of the medicine, like it can be made more affordable over time. And that's also a huge benefit which can be got, because there are like various phases of the clinical trials, and it takes 13 years, and the rest of the years are used to actually make the substantial, means at least get some profits out of it.
We have some more question?
Yes, well, it's, thanks a lot for the presentation, very interesting. I mean, there is so many things behind it, so I don't even know which question I should start off with.
Yeah.
But we have more time to discuss later. But so your ideas, and now we might keep it a bit more narrow to Sweden and say that accessibility, at least from the national data, is here. Is your idea to build a new database and then based on the selection criteria that you would have from a clinical trial, then get those
yes, for that.
Those patients?
Yes, for that actually we have decided, we made this demo. Now what is this exactly is that this can be a visualization. Now what we do is that you have certain inclusion and exclusion criteria for the clinical trials. We create a graph. This graph can be considered as the closeness graph. Now what is this closeness graph? It can be based on relationship. Every dot can either represent a subject, or it can represent a medicine which people use. And the closeness can be relationship, like they share the same doctor or they go to the same hospital. And what is it like? Let's say that your inclusion criteria for a particular clinical trial fits into, let's say, in this sector. Now, the thing is that if we do not get enough subjects in this sector, we can go to the closeness and we can assume that someone from this sector or this sector can also clear the test which we are planning. So, yeah, and this can be.
I would strongly suggest that you take a dedicated meeting with this team.
Yes.
Spending a lot of time exploring this data and the possibilities of it. I think we need to move on to the next team. Yep. Thank you very much. Thank you very much. Great job.